My name is Raj Dave. I'm an advanced practitioner in medical ultrasound. I'm going to talk about the basic anatomic scan, the anomaly scan from head to toe, the normal views. The common terminology: BPD, biparietal diameter; head circumference, HC; AC, abdominal circumference; FL, femur length; CM, cisterna magna; NF, nuchal fold. We're going to start from the head to the toes. So starting at the head, this is the view to measure the biparietal diameter and the head circumference. You should see the midline echo, the forks, right in the middle, equidistance. You should see the cavum septum pellucidum. Those are the three white lines in the front of the head, and the thalami. And you may be able to see the lateral ventricles, the far lateral ventricles. The near is usually not seen because of the machine noise. Okay. Now looking at the spine, you can more or less see the entire spine from the head to the sacrum. In that view, you can also see the fetal bladder and the cord insertion and the heart at the top with the descending aorta. Then there's another view of the spine in three sections: longitudinal. The first three are longitudinal section, from the head, the cervical spine to the sacrum, and the last one is the transverse view of the spine. We're going to the face now, and you can see the profile of the face. The other one is a coronal view of the face, and you can see the face and the lips and the nose at the top. And that's another coronal view to see the orbits. These two slides show the long bones, the leg, the femur, and the tibia and the fibia, and the upper arm, the humerus, the radius, and the ulna. Moving down to the chest cavity, we see the four-chamber view of the heart. You should see the hot cross bun sign, and you know that you have the perfect four-chamber view. The upper slide shows you the left ventricular outflow tract, and the next one shows you the right ventricular outflow tract. And moving the transducer further up towards the neck, you see the three-vessel view: the pulmonary artery, the aorta, and the superior vena cava. This slide shows the cord insertion, okay. And you can see the color flow around the fetal bladder to show the two umbilical arteries, and in the black and white three-vessel view. This is just to show the normal cord of the three-vessel, one vein and two arteries, and the other slide shows two vessels, vein and just one artery, one umbilical artery. This slide shows you the longitudinal section of a fetal kidney, and this slide shows you both the kidneys in the transverse section. This slide shows you the foot. Fetal biometry, measuring the head. At the midline level, where you can see the midline, the thalami, the cavum septum pellucidum, you measure outer to outer for the biparietal diameter. Depending on the graph your institutions are using, you can be outer to inner or outer to outer. I'm going to talk about outer to outer measurements. So that's anterior posterior, that's your biparietal diameter. Then occipital frontal diameter, OFD, that will give you a head circumference. And at the level of the ventricles, the lateral ventricles, you measure the anterior horn and the posterior horn. You can measure the head circumference two ways. Either do biparietal diameter measurement, and then the occipital frontal diameter, and the machine will give you the head circumference, or you can use the ellipsoid method. The abdominal circumference. Okay. You should see part of a rib, and you should see the umbilical vein 1/3 way in. That's your correct section. And you can measure transverse of the abdomen and anterior posterior measurement. And those two caliper placement will give you the abdominal circumference, or you can use the ellipsoid method. That's the femur. To measure the femur length, you should measure the shaft only, and both the edges should be blunt, and you measure the outer as near as possible. We're going to look at some growth curves, normal growth curves, and what abnormal growth curves would look like. This shows a constant growth velocity of the head circumference, HC, abdominal circumference, AC, biparietal diameter, BPD, and femur length, FL. Growth curve 2 again shows a constant growth velocity. However, the growth is on the lower range of normal, but it is growing constantly. Growth curve 3. This shows a reduced growth velocity over the period of gestation. Growth curve 4. This shows normal growth velocity for the biparietal diameter, the head circumference, and the femur length. However, the abdominal circumference, the growth velocity is falling off. Growth curve 5. This growth curve shows you an increase in the growth velocity, overall increase in the head circumference, the abdominal circumference, the biparietal diameter, the femur length, and the estimated fetal weight. To recap, start at the cervix in the longitudinal section for your anomaly scan and work methodically and systematically looking at the head, the ventricles, the thorax, the heart, the four-chamber heart view, the outflow tracts, the cord insertion, position of the stomach, the diaphragm, going down to the bladder, the limbs, position of the foot, looking at all the long bones of the leg and both arms, the profile of the face, and the coronal view and the longitudinal view, the orbits as well, and the cord vessels, how many there are, and the position of the placenta, and the amount of amniotic fluid. And that should be a standard anomaly scan. Your biometry at each scan after 20 weeks should include the biparietal diameter, the head circumference, the abdominal circumference, and the femur length. These are the standard 4 measurements to see what the growth velocity is. I'm going to take you through most of the common buttons that one would use when doing a scan. There are about 6 to 10 buttons. Always check that the equipment is plugged in and that's switched on. Once it's turned on, you then choose new patient. You input your data on a new patient, the patient ID, the last name, the first name, date of birth, and the due date or the last menstrual period. Then you start your examination. Okay. Before you do that, you'll have to choose the type of probe you're using and the type of patient you're scanning. So one of the buttons will either say transducer or a probe or an image of a probe. You press that and you choose which transducer you're going to use. After that, you'll need to choose what sort of examination you're doing. Are you doing an abdominal, gynae, obstetric? So we're doing an obstetric. You will then have to choose what stage of pregnancy you're doing. And this machine is setting it all up for you for the particular exam you're doing. The setting will be different for early pregnancy, for gynae, for a 20-week anomaly scan, or for a late pregnancy. Then you choose the type of examination. Now you're ready to start. Most of the buttons are very common to any machine that you would use. You'd have a freeze button. Then you have a button which says 2D, that's your 2D. A button which says color, that's your color Doppler. Okay. A button which may say PD, which is for power Doppler, or it might say CF, color flow. You have M for M mode cursor. Or you have PW, that's your pulse wave. Okay. any buttons that you choose, you can always go back by pressing the 2D. The other buttons that you'll see is when you want to do calculation. Usually you'll see two little buttons for calculation. One will have an icon of a ruler and it'll say calc, and that's to go into the calc and measure BPD and things like that, your OFD, other biometry. And the other button, which will just show two crosses, and that's your caliper. So when you use those calipers, the machine does not know whether you're measuring a biparietal diameter, a leg, abdominal circumference, or what. So it will not store any data on the obstetric form, report form that is on the machine. Okay? So it depends on straight measurement or not. Other buttons will show a print button. That's if you have a thermal print, you want to have hard copies, you can set that button up to print hard copies. You may have another button set up to save images on the machine's hard drive. You'll see some sliders. Okay? That's called the TGC, time gain compensation. Usually they're in the middle, which is the default setting. And what does a slider do? It adjusts sections of the screen. So the first slider may adjust the 0 to 2 centimeters, the other one 0 to 4, and so on and so forth. You have alphanumeric keyboard, so if you wanted to annotate anything, you can then annotate single umbilical artery. And there might be a pointer. You might want to point something. And usually they'll have a delete or a clear key labeled, and you press that and it will delete and clear all your alphanumeric key. 2D, C for color, PD for pulse Doppler, M for M mode, and this is pulse wave. To annotate, to clear annotation and measurements, your depth. It can be either a rotary switch or a button like that, and that's your focus. Again, can be a rotary switch or a button like that. And that's your audio, because if you on your Doppler you're not hearing any sound, ensure that it's not turned all the way down. Just rotate it clockwise to get the sound. And these are called the TGC, time gain compensation, and they should be by default in the middle of the sliders. That's your tracker ball, which will control most of your functions. Those 6 or 8 buttons or 10 buttons I've showed you are common to most machines. So, every transducer or probe will have some sort of a marking, a groove, a dot, a little light could tell you what the correct orientation should be. On here, you see a little groove and a dot. There's nothing on the other side. Okay? So when you do, always start off your obstetric scan in the longitudinal section. This is a longitudinal section with a groove or the dot facing the mother. And the groove and the dot on the screen will correspond to a little marking on the screen. It can be a name of the company, it can be a little dot, a little star, or whatever. Start in the longitudinal section of the mother, okay, right, and you can see the marker I was talking about. So we know the correct orientation of the probe. Okay? So the groove is towards the mother's head. So we know it's the longitudinal section, and the baby is lying in the longitudinal section as well, because we can see most of the body of the baby. Now I'm going to move the transducer in a transverse section, that is the groove towards me and the mother's right hand side, and that's the transverse section, and you can see the body is in transverse view. Okay. Now this again does not change. If you have moved it, I'm moved back into the longitudinal section. If you reversed the orientation, Okay, when you go down, the wrong part of the screen is coming into view. This will mistakenly say the baby is in a bridge position when it is not. So make sure the marker is facing the correct way to the groove. Hi, my name is Raj. I'll be doing a scan. What we're going to do is measure the baby, the head, the body, the leg. We'll measure the fluid around the baby, see the blood supply to the umbilical cord and to the head, and then I'll go over the results with you. Okay? That's the baby's heartbeat. Would you like to hear the heartbeat?
Yeah, okay. Thank you.
So you can see the head right down. So the head is down in the cephalic position.
Yeah.
Okay. So what we're going to do first is measure the head, and that's a section to get for the head. Okay. So you can see here, that's the baby's head. Okay, this white circle.
Yeah.
Okay, that's a midline echo we call, and this is called the cavum septum pellucidum. All right, so that I know my section is correct, and we can measure now from side to side. It's called the biparietal diameter. So we take the cursor, anchor it, and then bring it over, and on there it tells you how many weeks it is. Yeah, and it all depends on gestational age, which is right here. Depends on which charts you're using. And then we're going to do the occipital frontal diameter, that's front to back of the baby's head. Now this ellipsoid method takes much longer to do, so we just adjust it to make sure that it's nice and tight around the head. Okay, so that's the head circumference. Okay, now you don't always get it as accurate this way, all right? At this stage of pregnancy. Let's do another one. Just get a better section again. Head circumference. That's slightly better. Okay, so that's the head circumference of the baby. Okay, so that again here tells us what the head circumference is, this value here. So let's go into the leg now, the femur. Okay, and that's that white line there, very bright line. So we measure the femur now. From here to here. That's the femur done. Okay, that again tells you what the measurement is of the femur. Okay, roughly what the gestational age is. Okay, now we're going to go into the last measurement, which is the body. And those 4 measurements will tell us how the baby is growing. Okay, so that's a cross section of the baby's body. That's the baby's spine here, stomach, and that's a cord which comes inside here. So we know this is a good section to take our measurement. So again, we will do the abdominal circumference, the ellipsoid method. Okay. So that's more or less good. Let me just change this, make sure. Now this ellipsoid method takes much longer to do, okay? And if I can show you, if you do the other method, is the anterior posterior measurement, okay, and the transverse measurement. Now, see how quicker that is, and the computer will calculate the abdominal circumference. That it's much quicker if one can do it this way. So we've done that. Now we're going to measure the fluid around the baby. Okay. And we'll go to the deepest pocket on the outer side, and we'll call it quadrant 1. Okay, and you measure a free pocket. There shouldn't be any fetal part or umbilical cord or anything like that. That's your first pocket. So then we go into the other side, upper side left, and we're going to measure pocket number 2 straight on, and then the lower left side. Okay, so there's nothing there at the moment. So there's this pocket is 0, and the last pocket, as you can see here, and that's the last pocket. Okay. And this fluid gives you what the total fluid level is, right? And that's plotted against the chart to say whether it's reduced or not reduced. So we've done that. So we're going to do now the measurement of the umbilical cord, umbilical artery. And the blue and black just tells you, blue and red tells you whether the blood flow is towards the transducer or away from the transducer. It doesn't mean arterial or venous. So you get a good section. And that's considered a good trace because, as you can see, it's steady, it's bright all the way through, there are no dropouts, and all the peaks are even. Okay, you can do umbilical artery auto trace, it automatically traces it, or you can do a manual trace. Okay, you take the best peak and you can then gradually draw around it, and that's manual. Okay, and the measurements, you can get the measurements up here. It's PI and RI. Okay, the umbilical artery, and what we're looking for is that this is called the end diastolic part of the flow, that this is present. Okay, in compromised baby, this becomes lower and lower and lower until it's absent, and then it reverses. Okay, so we've done that. That looks good. That's what a normal trace should look like. We're going to do the head now, which is the middle cerebral artery. So get a good section, adjust your gain setting. See, this is too much gain, so we're going to make sure that we have correct gain. Okay. And this, get the angle correct and get the angle out because it's right at 90 degrees, so it's the best angle you can get. Now you can see, even though the peaks on this middle cerebral artery are fine, you can see the difference. This is nice and bright. You can get the echoes through the whole spectrum. Here you're missing it, right? Okay. So again, you can do the middle cerebral artery. You can do an auto trace, and you can see from the red that the computer is not able to generate. Okay, right? So what we're going to do is do a manual trace. We'll pick up the best trace, which I think is this one, the first one, and just trace it across. Okay. So that again gives you the PI and the RI value. Okay, so that again, it's normal. Yeah? In abnormal baby, this one increases, so this value becomes lower. Okay, in the umbilical artery, it gets bigger, so it's a reverse thing. So in here you want to see a high number. In the umbilical artery that we did, we want to see a low number. Okay, So if it's high number in the umbilical artery and low number here, then the baby is being compromised. Okay, so that again is a normal trace. So look at the placenta here. That's your anterior placenta. So that's the top part of the body, yeah, and that's the back part of your body. So that's the anterior placenta. Okay, this gray area you see here, that's the placenta. Okay, and you see this white specks there, that's calcification. As the pregnancy progresses, or the placenta matures, and this is completely normal findings, yeah, at this stage of pregnancy. If you see this early in the pregnancy at 20-25 weeks, then one would get worried about this. But at this stage, it's a completely normal finding. And I can show you. Let's see if you can see a kidney here. Can you see this little? I know there's some ribs shadowing here. See the shadow from the ribs there? Yeah, but there's a kidney here, right here. We can increase the depth. You can see if you can see the kidney here. Yeah, and that's completely normal. Right, so the other kidney should be here, but it's shadowing from the spine, so it's difficult to see. Okay, and that's the main blood vessel that goes through all our bodies, called the aorta. You can see it pulsating there. See that? Right? Okay, so and you can see if you scan at this stage, you can't see much. This little triangle there, you see that? That's a focus. So it should be more or less in the middle of the area you're scanning. Now observe what happens to the image as we change our focus. I'm going up. See the focus has gone up here? And see what happens to the image. I'll go up and down with that focus. Do you see that getting darker? Yeah. And then that's zooming in. Yeah. You can see the kidney there if you zoom in properly. Right? Or we can zoom out. It can be very small, difficult to see. Right there. Those are the shadows from the rib. Okay. And let's do the gain setting. So that's a little bit too dark. That's too bright. Okay. You see, that's what a gain does. Okay. So you want evenness of echoes. Just adjust it accordingly. You get nice even echoes, right? That's your end of your scan. Any questions?